The majority of hepatic infections are with which of the following type of microbe? A. Bacteria. B. Fungi. C. Prions. D. Viruses. The answer is D. Viruses. The majority of liver infections are viral in nature. Hepatitis A, hepatitis B, and hepatitis C are the most frequent agents of infection, with hepatitis C being the leading cause of liver transplants. Bacterial infections in the liver most commonly take the form of an abscess. Fungal hepatitis and prion infection of the liver are not generally seen. Which of the following viruses can cause hepatitis? A. Yellow fever. B. Cytomegalovirus. C. Epstein-Barr. D. All of these. The answer is D. All of these. There are multiple viruses that can cause hepatitis other than hepatitis A, B, or C. Among these are Epstein-Barr virus, cytomegalovirus, and yellow fever. You are the nurse for a new patient brought to the emergency department for a suspected gastrointestinal bleed. The patient is tachycardic and hypotensive, but conscious, responsive, and breathing spontaneously without any airway trouble. Which of the following is the best initial intervention? A. Insert 2 large bore peripheral IVs. B. Prepare to intubate the patient. C. Administer hydromorphone. D. Administer lorazepam. E. Administer warfarin. The answer is A. Insert 2 large bore peripheral IVs. This patient is suffering from a suspected gastrointestinal bleed, and based upon the report of the vital signs, he is hemodynamically unstable. In evaluating an emergency trauma patient, the ABCs must be assessed: A. Airway, B. Breathing, C. Circulation. In this patient's case, it is stated that he is responsive and breathing without any issues, indicating that his airway and breathing are both satisfactory. The next issue is his circulation. Given that he has a suspected bleed, and is tachycardic and hypotensive, it is likely that he is losing a significant amount of blood from his bleeding viscera. As such, he may need emergent, rapid fluid and/or blood product resuscitation. The best way to prepare for this immediately is to place 2 large bore peripheral 4 lines, such that resuscitation can be provided through these lines while the rest of the workup and treatment continues. Any delay in placing these lines delays the fluid, blood resuscitation of the patient, which can be dangerous. At this point, given that the patient has a protected airway and is breathing without issue, intubation would not be indicated. Should his airway or breathing status change, the need can be reassessed. Administering hydromorphone, a potent opioid, may be necessary if the patient is in a significant amount of pain, but that would not be the most pressing initial concern given that he is hemodynamically unstable. Administering warfarin, an anticoagulant, would be highly contraindicated in this patient, as he likely has an active gastrointestinal bleed and is hemodynamically unstable. Administering lorazepam, a benzodiazepine, is not indicated in this hemodynamically unstable patient with a suspected gastrointestinal bleed. After stabilization and continued demonstration of airway protection, if the patient is anxious, this need can be reassessed. You are the nurse taking care of an 83-year-old patient with a history of gastroesophageal reflux disease, GERD. They complain that they are having heartburn symptoms at night when trying to go to sleep and in the morning when they wake up. In addition to addressing their medical therapy options, you recommend which of the following to the patient? A. Do not take calcium carbonate for symptomatic relief. B. Avoid spicy foods before going to bed, but otherwise eat a whole meal right before going to bed. C. Eat your last meal at least 3 hours prior to going to bed, and sleep as upright as possible, with multiple pillows. D. Eat immediately prior to going to bed. E. Drink 1 cup of coffee prior to going to bed. The answer is C. Eat your last meal at least 3 hours prior to going to bed, and sleep as upright as possible, with multiple pillows. This recommendation involves fairly simple lifestyle changes that have the potential to greatly decrease the patient's symptom burden. Heartburn symptoms can be exacerbated in patients who eat spicy foods, at any time, who drink coffee, and/or who eat meals shortly prior to going to bed, since the food can physically reflux back to the distal esophagus from the stomach prior to being digested more completely. Thus, any of those recommendations would be inappropriate. Further, in a patient who is acutely experiencing acid reflux symptoms, it is typically appropriate for them to take calcium carbonate to neutralize the acid and relieve symptoms. As such, advising the patient to not eat immediately prior to going to bed, and to remain upright, to physically minimize reflux of contents, would be the most appropriate recommendation. You are a nurse at an oncology infusion center taking care of a 45-year-old female with breast cancer, currently being treated with chemotherapy. While receiving her chemotherapy infusion, she complains of severe nausea. Which of the following medications would be most appropriate to treat this patient's nausea assuming she has a normal QTc interval? A. Acetaminophen. B. Ketorolac. C. Ibuprofen. D. Meloxicam. E. Ondansetron. The answer is E. Ondansetron. This patient, who is actively being treated with chemotherapy and experiencing severe nausea, is most likely suffering from chemotherapy-induced nausea. The most appropriate first-line treatment for chemotherapy-induced nausea in a patient with a normal QTc interval is ondansetron, also known as Zofran. Ondansetron is a serotonin 5-HT3 receptor antagonist, likely accounting for its anti-nausea properties. A side effect is QTc interval prolongation, and as such, careful consideration as to whether or not to prescribe ondansetron should be given for patients with baseline prolonged QTc intervals. Acetaminophen, an analgesic, would not treat nausea, nor would ibuprofen, meloxicam, or ketorolac, all NSAID medications.